Our next section is urinary tract infections. Now, urinary tract infections all are caused predominantly by E. coli or Escherichia coli. The most common cause of these urinary tract infections is also predisposed by some form of instrumentation or foreign body invading the urinary tract. Cystitis causes pyelonephritis. Pyelonephritis can become an abscess. What we see is that anything that can cause a cystitis can progress onto causing a pyelonephritis. And the pyelonephritis, very rare, becomes a perinephric abscess. A perinephric abscess is extremely rare because the kidney is an extraordinarily vascular structure that fundamentally has an almost impossible time of being able to have a collection in the kidney. Very unusual because the perfusion is so excellent. Cystitis can be caused by just women by themselves because of the short urethra can have a cystitis without any predisposing condition. However, it's also caused by stones or strictures, tumors, and some form of obstruction. So cystitis can be caused by stone or stricture, tumors or obstruction, stone or strictures, tumor or obstruction, stone or stricture, tumor or obstruction, stone or stricture, tumors or obstruction. Yes, cystitis can be caused by stone or stricture, tumor, obstruction, catheters, and these things can also go on to pyelonephritis. Now remember, a woman doesn't have to have an anatomic defect. So a woman doesn't particularly have to be scanned. Men always need to be scanned because if a man has a urinary tract infection, it means there's an anatomic abnormality. If a man has a urinary tract infection, it means there's something wrong. Something wicked this way comes through my urethra. That is evil. Not semi-evil, not quasi-evil, not the margin of evil, no, but some fully evil. If a man has a urinary tract infection, a man must be scanned. Scan the man because he's got a foreign body. Now, both urinary tract infections can give you frequency, urgency, burning, dysuria, frequency, urgency, burning, dysuria. Oh, frequency, urgency, burning, dysuria, frequency, urgency, burning, dysuria. That's both of them. That's both of them. Frequency, urgency, burning, dysuria, frequency, urgency, burning, dysuria, frequency, urgency, burning, dysuria. So therefore, cystitis, pyelonephritis, frequency, urgency, burning, dysuria. Frequency, urgency, burning, dysuria, but that's both. The best initial test is a urinalysis for both. What'd you call me? Urinalysis. Urinalysis, a urinalysis. What would you say? Urinalysis. I am not. Urinalysis. Yes, but what part of the urinalysis is the most important? Is it the protein? Is it the nitrites? Is it the bacteria? Is it the white cells? Is it the red cells? To tell you whether there's an infection. A, B, C, D, E, A, B, C, D, E. And the answer is the white cells. Protein can be up from any infection or glomerular disease. Red cells can be there. Well, you could have red cells from stones, strictures, tumors, trauma, infections. Red cells, nonspecific, glomerular disease. Nitrites is the metabolic end product of bacteria in the urine. Nitrites is the metabolic end product of bacteria in the urine. So therefore, nitrites is kind of like the stool of bacteria. Nitrites, you ate the nitrate. They ate the nitrate and they made the nitrite. E. coli eats nitrate. It ate nitrate. It ate nitrate. Nitrate and made it into nitrite. Oh, they ate the nitrate and made the nitrite. Okay. White blood cells, white blood cells. White blood cells, the most important. Now, bacteria in the urine is really only significant in a person who is pregnant. Except for the pregnant woman, bacteria alone in the urine is not significant unless it's a pregnant woman. 1/3 of women with bacteria in the urine develop pyelonephritis, pregnant women. But everybody else, it's irrelevant. No, frequency, urgency, burning, dysuria, white cells in the urine culture is the most accurate test. Urine culture is the most accurate test. Now, remember, sonograms and CTs don't diagnose cystitis and pyelo. Sonograms and CTs tell me you've got cystitis and pyelonephritis. Why? Why do you have it? You've got cystitis and pyelonephritis. Why do you have it? You got cystitis and pyelonephritis. Why do you have it? Why? Why? That's both of them, both of them. How are you going to tell these apart? And the answer is, this one gives you flank pain, pain in the costovertebral angle, pain in the, ow, banging my kidneys, that hurts. Whereas cystitis gives you pain above your public area, suprapubic pain, suprapubic pain, pyelonephritis, flank pain, cystitis. The other thing is pyelonephritis and abscesses. See the big fever? Look at that big fever. You can't avoid it. Cystitis gives a little fever. You can barely find it. Cystitis gives a little fever. Pyelo and abscess give a big fever. Little fever, big fever. Little fever, big fever. Suprapubic. How can I tell these apart? They both give frequency, urgency, burning, dysuria. Frequency, urgency, burning, dysuria. Suprapubic pain, flank pain, big fever. Okay. Cystitis, a little fever. So that means, ready? Here's the case. 23-year-old generally healthy college student comes to see you because she's got burning on urination. She has white cells in the urine and burning on urination. What's the next best step? Urine culture, your renal sonogram, renal CT. Start treatment with Bactrim. And the answer is start treatment with Bactrim or trimethoprim sulfa. If you have a clinical case of dysuria and white cells in the urine, you don't need a culture. If you have dysuria and white cells in the urine, uncomplicated, you don't need a culture. You don't need a culture. You don't need a culture. And you can use trimethoprim sulfamethoxazole for 3 days. Trimethoprim sulfamethoxazole for 3 days. 3 days, unless it's complicated. Unless it's complicated. You see these things? Stones or strictures, tumors or obstruction. Stones or strictures, tumors or obstruction. When we say complicated, do you know what we mean by complicated? We mean stones or strictures, tumors or obstruction. Stones or strictures, tumors or obstruction. What do we mean by complicated? We mean these things. Stone or strictures, tumors or obstruction. That's what we mean by complicated. That's what we mean by complicated. Bactrim for 3 days. If it's complicated, stone or stricture, tumor or obstruction, pregnant, 7 days. 7 days if it's complicated. Now, what's the treatment for pyelonephritis and abscess? Pyelonephritis and abscess are treated with any of the gram-negative drugs. Ampicillin and aminoglycoside, like gentamicin, or a fluoroquinolone, like ciprofloxacin, or any of the other gram-negative drugs, like aztreonam, or piperacillin tazobactam. Any of the gram-negative drugs. Any of the gram-negative drugs. Now, pyelonephritis. How do you tell it apart from cystitis? Pyelo, they're sicker. Pyelo, higher fever. Pyelo, flank pain. What's the most accurate? The culture. Diagnosis? CT? No, CT doesn't diagnose pyelonephritis. Dysuria, fever. Ow! Dysuria, fever. Ow! Tells me I have pyelonephritis. The CT tells me, why'd you get it? Do you have an obstruction? Do you have a stone? Do you have stricture? Do you have obstruction? Neurogenic bladder? That's an obstruction. The abscess must be diagnosed with a scan. Sonogram is not as good as a CT. CT is not as good as an MRI. MRI is not as good as a most accurate test for an abscess is a most accurate is a biopsy. Most accurate is a biopsy. Most accurate test is a biopsy. Most accurate test is a biopsy. The most accurate test is a biopsy. The most accurate test is a biopsy. Why? Because you cannot stain a CT. You can't culture an MRI. You can't get sensitivity testing on a nuclear scan. You must biopsy, antibiotics, and drain. Now, why you must drain, why you can't use antibiotics alone, is because this is something that developed while you were on antibiotics. You ready? Cystitis, 3 days of trimethoprim sulfa or a fluoroquinolone. ciprofloxacin and a fluoroquinolone, or Bactrim for 3 days. 7 days if it's complicated. Pyelonephritis, worse, any of the gram-negative drugs. Treat longer. Abscess, you must drain. Because how do you know? It was pyelonephritis. You started them on therapy. They didn't get better. Why didn't they get better? Because they have a collection. They have a collection. Urinary tract infections. Some form of foreign body or anatomic problem. That's the key issue. A woman, because of the short urethra, can have a couple of cystitises, no problem. However, anybody else should be imaged because it's an anatomic problem. It's an anatomic problem. It's an anatomic problem. Find the anatomic cause and relieve it. Abscess has to be relieved by an anatomic treatment. Let's look at the table here. 3 days uncomplicated, a Bactrim or a quinolone. Diabetic is also a type of complicated because people there in diabetics, the neutrophils don't work well. Diabetics, the neutrophils are drunk on glucose. Hey man, you want to go get the E. coli? No, let me have another hit of that glucose. So the E. coli doesn't get killed because the neutrophils are so-called lazy leukocytes. Lazy leukocytes and diabetes don't feel like killing. Yeah, I'm gonna kill that E. coli someday, he's gonna die. But they just don't feel like getting to it. So you have a hard time eradicating the infection. Now the reason in men it's longer is because if a man has it, often he often has prostatitis as well, and cystitis in men involves the fact that there's an anatomic problem. Now, see this drug here, nitrofurantoin? Nitrofurantoin is a one-disease drug. Nitrofurantoin is a one-disease drug, and nitrofurantoin basically is a urinary antibiotic only in pregnant women with cystitis. Cystitis, one of the most common bacterial infections there is. Get me a urinalysis and start treatment. That's it for urinary tract infections.